And then the hip is involved obviously in gait. Right, so then what are the paired motions that we evaluate in the hip? So you have flexion, extension, abduction, adduction. So what is this? External rotation, because you always reference the front part. So this is internal rotation, external, internal. And there's circumduction, but it's not. You're not going to be measuring circumduction with your goniometers, inclinometers, that kind of thing. So the loose pack position is 60 degrees flexion, 30 degrees abduction, slight external rotation. It's like this. Okay. And then the close pack is going to be extension with medial rotation, something like this. And then have the ligaments on the front here. This iliofemoral ligament is what's called the Y ligament because it has these two parts here. And then on the posterior side, you have the iliofemoral here. All right. Now, in the case of the hip, you have the anterior ligaments are the strongest. So the most common dislocation of the hip is posterior, which is the opposite of the shoulder. Shoulder dislocates normally, most commonly anterior. Hip dislocates posterior. We'll be talking about hip dislocations in a second. And so, all right, now you have the bursa. You have the iliopsoas bursa, which is deep inside here on the front of the iliopsoas. Then you have the greater trochanteric bursa, which is more superficial. And then you also have the ischial bursa on the ischial tuberosity. And then the contractile tissue, obviously we talked about the muscles here before when we talked about the pelvis, but basically you have muscles that cross the hip. You have all the flexors, you have extensors, you have the external rotators, internal rotators, and then what are these muscles here?
Adductors.
Yeah, adductors. So then, you know, they're all listed in the notes. You can go over those. With extensors, you have the glute max and hamstrings, and rotators. And so in this position here, the TFL is more of a medial rotator. And then hamstrings are going to be important because, you know, you talked about hamstring tears, right? You see that. So basically it's just a contractile tissue problem where, so you want to be aware, you know, you have the semitendinosus, membranosus on the medial side and then the biceps femoris on the lateral side. Then adductors, you can talk about groin pulls. And then sartorius and pectineus, TFL. And rectus femoris, we talked about already. All right, so now that's it for the contractile stuff. Then we have nerve tissue. And then really in the hip, we're really only talking about the femoral nerve. We talked before about what was that nerve condition where you can have it on the side here? It's part of the lumbar plexus. What part of the thigh is this? Lateral. And what bone is this? Lateral, femoral. What's another word for skin? Cutaneous. So that could just call Morales and paresthetica. So that gets impinged here at the inguinal ligament. But in this case, the hip, we talked before already about femoral nerve. In this case, you know, we talked about the femoral nerve traction test. So there's the sensory distribution of the femoral nerve. It does have some branches that go out down to this area here, but primarily you're looking at here. You can be injured in fractures, dislocations. You can have maybe repetitive muscular strains that can affect that femoral nerve as well. And then the vascular tissue, the hip, is that you have this ligamentum teres, which attaches to the head of the femur. from the acetabulum, and then inside of that ligament, there's an artery that goes to the head of the femur. So if you had some type of dislocation or traumatic injury to the hip, it may affect that artery to the femoral head. All right, this page is not in the notes, but it's a summarization of all the different conditions that we're going to be talking about. So again, we start out in talking about bones and what happens to bones. Usually it's traumatic, and what's going to happen. They're going to break. Right, so you have fractures. Hip fractures are a big thing. Right? So you have hip fractures. You'll have another thing that we'll talk about, which slipped femoral capital epiphysis, femoral neck fractures, acetabular fractures, and then avascular necrosis. It's kind of the same thing we talked before about in the navicular. You can get a condition that's avascular necrosis of the hip, and then that's where that extra artery that we're talking about can become significant. And then just ligaments, joints, you have DJD of the hip, just like other DJD problems that we've talked about before. Dislocations of the hip, bursitis. And then we go into contractile tissues. Basically, you're either going to have groin pulls or hamstring pulls. Those are pretty much the contractile tissue problems of the hip. And then nerve entrapments. You're looking again at femoral nerve stuff. So femoral neck fractures. Here basically is the femoral head. So the neck is just below the head, so that's where you're going to have the fractures right there. There can be a traumatic condition where you have a high velocity impact. So it could be like somebody's in a head-on collision in a car or something, and you get shoved in the dash, pushes back like that. You can either break the femoral neck, or you can have a hip dislocation. Or you can have a stress fracture. So they can have severe hip pain, deformity. It's either acute injury or dramatic change in activities. There's going to be tenderness in that area. You know, a lot of times, again, you can have post-menopausal females with osteoporosis. And sometimes it's not sure, you don't know if they fell and they broke their hip, or their hip broke, which caused them to fall. You know, you can just have, because if the bone is weakening, they could have been in some awkward position where all of a sudden their hip snapped and then they fell. Versus if somebody fell and then that caused them to break their hip. So really the way for special tests is, obviously you try to do a favor test on them, they're probably going to have some symptoms, but based on the history, you know, you've got to be aware that if you suspect there's a hip fracture, that you may want to be careful when you do those types of tests. Because one thing you can do, I think it's called like an anvil test. So if somebody's, like if you're laying like that and you just go like that. It's like percussion, you know, before when we did it, like say if you tap here and you feel pain there, so if you do that and you feel pain in the hip, you know, that's an indication that there's some inert tissue problem or it could be a hip fracture. And then when you talk about acetabulum, it's a fracture of the pelvis rather than the actual femur itself. So you can have different kinds of breaks that can go in different parts of the acetabulum. And again, there you're talking about some severe traumatic injuries. So again, you're not going to see that acutely. You may see them for, you know, post care for residual pain or something like that. Obviously, you know, they're going to have pain in all the ranges of motion.